So this is the second chapter of PD General Anatomy. This is about the bones, and in this video I've explained all the things which I thought needed some explanation, and in the upcoming video we'll go over the chapter, and that will become very easy then, right? So for example, this block here, it's bone, and you divide it in three parts, and 2/3 of it is salts, and 1/3 of it is basically connective tissue. So the salts are inorganic and the connective tissue is organic, and the salts are mainly the calcium phosphate salts. In that, you have to remember the name hydroxyapatite crystals, right? These are the salts of calcium phosphate which make the bone. Now, what the salts do, they provide hardness and rigidity. And what the connective tissue does is it provides toughness and resilience. Now, if you take this 2/3 salts and you remove it completely from the equation, so let's suppose there's a bone and there's no salt in it, it would become very soft and you can just make a knot out of that bone. But if you take the connective tissue, which is 1/3, and you remove that, so then the bone would become very fragile. It would become like a piece of chalk and it would just crumble, right? Now, what the salts do is that they resist compressive forces, right? And what the connective tissue does is that it resists tensile forces. Now, if you take compression, you can think of it as squeezing the bone. So the salts don't allow the bone to be crushed under any compression, and the connective tissues do not allow the bone to be distorted. So in the presence of salts, the compressive forces cannot act, and in the presence of connective tissue, the tensile forces cannot act, right? Now, moving on. Bone is a living tissue. Why? Because it has certain properties. The properties that are listed there are that bone is vascular and that it can be injured, and when it gets injured, it can heal itself and it can also regenerate itself. Also, bones can atrophy and hypertrophy. Atrophy means they die when you don't use them, and the hypertrophy, they multiply or they increase in the size when you use them a lot. It's similar to muscles. When you don't use your muscles, they die, and when you use them a lot, they hypertrophy, they increase in size, right? Now, then there is classification of bones. The first classification that we'll see is, before anything, I'll explain this thing. The first classification is the regional classification. Regional means that this part in this block here, it's the axial skeleton. So what is basically here? The skull, the vertebra, and the thorax and abdomen, right? So this is basically the axial skeleton, right? And the limbs, upper limbs and the lower limbs, they make the appendicular skeleton. So whatever is in the center, it is the axial skeleton, and the limbs, lower limbs and upper limbs, are the appendicular skeleton. So this is the first classification, how you classify bones. Now coming to the second classification, that is based on the shapes. So bones can be divided into 7 types based upon the shape. The first type is the long bones, right? So long bones are like the cylinder here that I've drawn, and at the end of the cylinder there are similar edges. So we call the cylinder the diaphysis, and these edges are called the epiphysis, right? Then if you take a cross section of the cylinder here, it would look something like this triangle, right? It has 3 corners and it has 3 sides. Long bones are further classified as typical long bones, short long bones, and modified long bones. What is typical long bone? Which has 2 epiphyses. The examples are like femur, the major long bones like the femur, the humerus, the tibia, such long bones. What is a short long bone? A short long bone is a long bone which has a single epiphysis, one epiphysis, right? And the example of that is the phalanges, right? So your phalanges have a single epiphysis, and that is a short long bone. And a modified long bone is one which has no medullary cavity in it. Now, moving on. Now, this was the shape classification, and the first shape is long bones. The second shape is short bones, right? So the best example of short bones are the carpals and the tarsals, like the bones in your wrists and the bones in your ankle, right? Then we have flat bones. The purpose of these flat bones is that they provide protection. So which bones are giving protection? The skull bone, which is giving protection to your brain, and the thoracic cage like the ribs. They provide protection to your thorax. So these are the examples of flat bones. Now we have some irregular bones. Irregular are the vertebra, right? And we have some pneumatic bones. Pneumatic because they have spaces in them, air spaces, and these spaces provide, firstly, they reduce the mass in that bone. So when there is less mass, it would be lightweight, right? And the second purpose is to provide the timbre in the voice, right? So there is resonance. So voice or sound, it resonates in those bones and it gives the timbre to your voice. Then there are some sesamoid bones. So sesamoid bones are bones where, so I'll explain sesamoid bones. So this is a bone and this is another bone, and these bones are connected by a tendon. Soon you will study what a tendon is, or the softer cord structure is connecting these two. Now, when these two bones would move, there would be a lot of friction created in this cord. So, this cord also develops a little bone, right? So, that is known as the sesamoid bone. The best example of this is your patella, right? So, when your femur and your tibia are moving and the cord, the tendon which is connecting these two bones, it is under a lot of friction. So it has developed this bone, small bone, the sesamoid bone, and that is patella, right? And lastly, we have the accessory bones. Accessory bones are like, they are not present in everybody. There's a small population, like depending upon what that population does, they develop these bones. So specifically the riders, they have a certain bone. So those are like accessory bones, right? Now moving on to another classification, the developmental classification. The developmental classification is where the bones developed from, right? So on the basis of that we divide bones. If they were derived from a membrane, that membrane got calcified and so on, so they are known as membranous bones or dermal bones. But if they were derived from a cartilaginous model, so cartilaginous model was laid down and then that model slowly calcified and became a bone, so that is known as a cartilaginous bone. So we have a membranous bone which derived from a membrane that got calcified and cartilaginous. And then we have some bones which are known as membranocartilaginous. So they have both types of origins. Now, moving on. So the next is structural classification. Structural classification is on the basis of two types of structures or levels, a macro level and a micro level. So at the macro level, we have compact bones and cancellous bones. Compact bones are basically present in the epiphysis and the cancellous bones are present in the diaphysis. So before that, I've already told you what a diaphysis and epiphysis is. Let's suppose this is a bone and this shaft, this long part is the diaphysis and these ends are the epiphysis. So in the diaphysis you have the cancellous bone and in the edges you have the compact bone. Now how do you remember that? So compact bone is like ivory, right? And cancellous bone is like a mesh. So what do I mean by ivory is that it is hard, right? It is hard and it has small, very tiny pores. So it is porous, but it's very hard and brittle. The cancellous bone, on the other end, is like a sponge, and it is having a lot of spaces. Those are known as the trabecular spaces, and those spaces contain bone marrow. So, compact bone is like ivory, and the cancellous bone is like a sponge. So, compact bone is in the epiphysis, and the diaphysis we have cancellous bones. And each of these type of bones have something called the lamella. So lamella is nothing but a simple tissue that makes bone. Now if that tissue becomes twisted like this, which I have shown, then we call it the Haversian canal, right? So this, if the lamella twist like this, they form the Haversian system. If the lamella, they arrange themselves into rods and plates, then it becomes the trabecula, right? So trabecula are present in the cancellous bone and Haversian system is present in the compact bone. the compact bone will not allow the bone to get twisted, right? I told you it's hard and rigid. And the cancellous bone will not allow it to get compressed because it has a lot of, those tiny, tiny spaces, so you cannot just squeeze it. It increases the surface area, and you just simply cannot squeeze that surface, right? So cancellous bones won't compress and the compact bones won't twist. Now, moving on, we have another thing that needs explanation. So these are the layers of an adult bone, right? If you take a bone, these are the layers that make that bone. The first layer is periosteum. And about periosteum, remember that it is highly vascular and highly nervous, which means it has a rich blood supply and a rich nerve supply, which means that it is very sensitive to pain, and whenever this layer gets touched, you have pain, right? You feel pain. So the first layer is periosteum, and periosteum is of two types, the fibrous one and the cellular one. Then underneath that periosteum, we have Sharpie's fibers. And these Sharpie's fibers, they connect the periosteum to the bone. And then the bone is the compact bone, because in the diaphysis, we have compact bone. So underlying bone, whatever bone it is, if there's underlying cancellous bone, so it would be cancellous, or if compact, then compact. And underneath that compact bone is the endosteum. So the outer layer was the periosteum, and the innermost layer of bone is the endosteum. And then you have the medullary cavity and end, right? So we're done with all of the chapter. Just the last thing is left, which is the blood supply. And for the blood supply, let's suppose that the cylinder that I've drawn here, it's a bone, and an artery, this artery, it comes and it enters the bone, and the place that where it enters is known as the nutrient foramen, and this artery is known as the nutrient artery, right? And then it moves upwards as well as downwards, an ascending branch and a descending branch, and they supply the bone, right? So nutrient artery is the main supply of a bone, any bone, right? Now, nutrient artery supplies everything except the outer 1/3 of the periosteum. And for that we have periosteal artery, right? So how many arteries? One nutrient artery and then the periosteal artery. And there are a few other arteries as well, but they're not very important, like the metaphyseal artery and so on, right? Now, another thing about the nutrient artery is that it has a rule. The rule is that to the elbow I go and from the knee I flee. So what that means is that there is a growing end of a bone. In the lower limb, let's suppose this is femur and this is tibia, and this is the upper end of femur. This part is the upper end of the femur and this part is the lower end of the tibia. So the upper end of the femur and the lower end of tibia are the growing ends in a lower limb, right? So this in between them is the knee, and the growing ends are away from the knee. So the nutrient artery will always move in the direction, the nutrient foramen will always be directed towards the growing end of the bone. So in cases of femur, it will be directed upwards. In case of tibia, it will be directed downwards, always away from the knee. And to the elbow I go, this means that, let's suppose this is humerus and this is tibia, radius and ulna. Humerus and the place where they meet, humerus, radius and ulna, that is elbow joint, right? And the growing end of humerus is also at the elbow joint, which is the lower end of humerus. And the radius and ulna, their growing ends are also at the elbow, right? So the nutrient foramen is directed downwards in humerus and upwards in radius and ulna. While in the case of femur, it was directed upwards, and in case of tibia, it was directed downwards, right? So this is what it means, and that's all.